asking you, do you think the Kenyan government is adequately addressing the health concerns of its citizens? Do you think the Kenyan government is adequately addressing the health concerns of its citizens? Please send us your views at KTN News, at Yvonne Okwara. Remember to use the hashtag Worldview. I'll be tracking your feedback using that hashtag. And we will definitely be taking a look at your feedback and sharing that with you throughout this live newscast. So we promised you a conversation on this, but let's just put some perspective to that. Now, the WHO last year spent around $71 million on AIDS and hepatitis, another $61 million on malaria, and $59 million on tuberculosis treatment. Access to affordable healthcare remains a global challenge, and that is why experts are now advocating for new technologies that will not only help prevent diseases, but also access to quality healthcare. So one such innovation is iSecure, which is a subscription-free project that aims at improving access levels to quality care and safe medicine across the country. Now joined by the CEO, Dr. Mokalantam, to talk a little bit more about this innovation, as a key to global health solutions. Thank you very much.
Thank you for having me.
Good. So let's just start by talking about this innovation. Tell us about iSecure. What is it and how does it work?
Great. So delighted to talk about it. The journey of iSecure started about in July 2015, where we responded as a company to a call from the Boehringer Ingelheim, Ashoka. Those are global health organizations, Boehringer being a pharmaceutical company, to say, what can we do to improve access to safe care and medicines in an affordable way? And we were one of 124 companies that competed for that challenge, and we were fortunate to be the winners of that challenge globally, which speaks, first of all, to the level of work that is being done in Kenya and in the Africa region for us to rise above other companies to get this award. Now, what we proposed is that we can use mobile technology to connect every household to a doctor and to treatment in the most affordable way. We had a proposal that said we should look for a way to reward households that were practicing good lifestyle, had healthy lifestyle habits, reward them such that they can use the rewards they've earned to pay for healthcare, and then use technology, obviously, to connect them to the doctor and to their pharmacy. So what iSecure does in a nutshell, it says, play to pay. That is, you enter your symptoms at home, say how you're feeling. You can register friends friends and family on the application. So you're promoting healthcare within your nuclear group. And then you can also share medical tips. I'm a diabetic. Don't eat this food. Don't eat that food. If you like my message, I earn points. And if you earn points, at the end of the month, you could have earned almost 500 shillings, which would help towards your care. So we have taken a huge bet to say we should invest in lifestyle, we should invest in health in the house at the household level, and we'd have better returns.
So it has a dual aspect, preventive and curative as well.
That's correct.
In terms of sharing the information about how to stay healthy.
That's absolutely correct. And so now, the problem that we're looking at is every month in Kenya, there are 1.7 million households. 1.7 million households that have a sick person. Our data shows that 80% do not know where to start. Now, they would end up making a default decision. You'd go to the dispensary in the neighborhood, in the village, if you're there. Or if you're in the city, you would choose one of the options based on billboards. And you go queue, and you're just not sure what to get. Who you're going to see, what you're going to experience, you have no clue. Now, in the age of consumerism, in the age whereby people are looking for information, healthcare is behind, whereby we are still purchasing healthcare without knowing what we're purchasing. And even if we purchase, we don't know whether what we purchased is good enough. And so iSecure allows you to say, I'm going to book a time with this doctor, avoid the queues. You know what the doctor, where he went to school, whether he has treated similar patients like yourself. You can see his rating. You know how much he's going to charge you. And so it's a very predictable outcome in many respects. And our data also shows that your first doctor visit determines your outcome for any disease that you have.
Yeah.
And so, I mean, there are so many stories of people having cancer, but they get started treated with malaria.
Yeah.
By the time they discover it's cancer, they've spent a lot of money, wasted time, and it makes the outcome worse.
Absolutely. All right, I'd like us to continue talking about this, but let's see this in action. So there's a video we have that, just shows how iSecure works. So let's take a look at that and, just sort of have a practical feel of this innovation.
We know you spent years in school to earn your title. However, the titles can be confusing to patients at times. With iSecure, you are matched to patients based on symptoms in your profile. Please add symptoms that you frequently encounter in your clinic. Here is how. Click on the menu icon at the top left corner. Click on Profile. Click on the Next Profile tab. Select Symptoms. Click on the red plus sign icon to add symptoms. Select common symptoms as seen in your practice. Click Save. Add or edit more symptoms or delete symptoms as needed. From now, patients can find you simply by entering symptoms they experience. It's convenient, it's integrated, it's secure.
Right, so now that we have a sort of feel of that, I think that helps to explain a little bit of what you were talking about. So tell us if this is already operational, is it being used? Because now we're having this conversation, there's many people who will say, so, where do I get my hands on this app? How do we start to use it? Have you done a rollout program or a pilot project? What's that like?
Sure. So we decided to roll it out as a campaign, which, borrowing from other quarters, we named the campaign Making Health Great Again. That means we as actors can really change the narrative through this application. And so what we're asking folks to do is if you download the app, you can use it to enroll your family members. If you know your doctor or you know a friend who is a doctor, tell them to try it. Trust yourself. And if you know a pharmacist, tell them to try it and create a profile. It doesn't hurt. It's just on your phone and you should have it. So that is what we're trying to do. Right now, within the last 2 weeks, we have over 200 providers. And by providers, we mean specialists, so that endocrinologists, cardiologists, a few surgeons have joined. We have general practitioners. We have clinical officers, we have nurses, we have wellness coaches, we're looking for psychologists, nutritionists. Everybody can create a profile and we approve.
Okay.
Then you can be visible on the platform immediately. And provide services to the community.
Okay.
You'll be asked to create a profile in that process so that you are transparent so people know exactly what you're offering.
So the sort of provider they're dealing with. So this comes in to sort of address the issue of access to healthcare. So could you talk to us about, the sort of general state of that? Healthcare is expensive, it's out of reach. I mean, doctors and a lot of the providers you're talking about, endocrinologists, cardiologists for that matter, just seem like they're out of reach for general citizens. You want to be, when you're sick and you're looking for help, access to healthcare is something that goes a long way in this part of the world. So speak to us about where we are with that, and therefore, that's how this one plugs into that. What's the status of access to healthcare in Kenya and across the continent?
Very important question, and I would like to say very clearly that as a public healthcare official and expert, we shouldn't think about access when we're going to the hospital. Healthcare starts in the household. I did my training with Hans Rosling, he passed recently, and he said, the conversations in the living room will determine your choices in terms of what you eat, how you eat, and your behaviors. The conversations in the kitchen will determine how hygienic your food is. What happens in the bathroom determines your sanitation. What happens in the bedroom determines the population size that you'd have to manage. And that is really where healthcare starts. So what we have seen a dramatic shift over the years is that the household conversation around healthcare has dropped dramatically. So we really need to bring healthcare back in the home setting. Now, obviously, when now we start thinking, I fall sick, what happens is really where we need to say, okay, how can we make that affordable and accessible? Now, we had a flux in terms of the whole dynamics of healthcare. And I'll paint a little bit of a brief picture here. In the 1920s and 1930s, coming out of the Depression, most governments invested in healthcare, and that's where you had the WHOs being born, to say we need to have an agenda where we're enabling states to build national facilities to provide basic healthcare. With that, you had district hospitals being built, and you had the notion of a centralized location, provincial hospitals to provide care. Then you had the attention given to epidemics, the cholera epidemic, polio vaccines, so a lot of scientific discovery happened within the 50s, 60s, 70s that said we should invest in the global health agenda around preventing epidemics. And then now we moved fast forward. And one thing is to say, at that point, healthcare, nobody talked about cost. Nobody talked about, it was about build the infrastructure, train the people, and healthcare was free. Now, we came into the 1990s, whereby the economies now start changing very dramatically, and it's happening across the globe, whereby services now become expensive. The surgeon wants to be paid, excuse me. The nurse wants to be paid, excuse me. The anesthesiologist wants to be paid. And by the way, commodities have to be paid. So the global health agenda moves from one of free services and global epidemics to one of value for money. Show me the service. Now, what happened with that was it was no longer sufficient to just say, well, I have a good doctor who knows how to treat me. You needed accountability. So electronic medical record systems, you need to calculate everything that is happening in the hospital. And so now we are at a phase whereby it is absolutely driven by value for money. And it's a very dangerous phase in the sense that if you can afford it, you can get the best care within the same zip code. If you can't afford it, you are really fighting for life. And so...
so where should we be looking to now? Because it's such a great journey you've painted with the start of healthcare. So as we conclude, where do you see us going? What should we be focusing on now? The WHO is sitting in Geneva for their meeting. We will have a new Director General. Where should our focus be as nations, as WHO, at the macro level?
So healthcare is one of those areas that cuts across all strata of society. It starts with ourselves. So we have to take good care of ourselves, and that's where prevention comes in. If we cannot, then the family has to think about it. If the family cannot, the neighborhood or the community, or in the case, the county is the next level. If the county cannot, the national government. If the national government cannot, you have the global community. And that's why global health is important. Because if people start getting sick and diseases, it quickly crosses boundaries. So global health gets the same attention as terrorism at the national level. Well, the global health dynamic is changing. You have uncertainty in terms of the global health policy at the US level. EU countries are revisiting their position in terms of how much money they can contribute to member states to cover healthcare. So it's putting a lot of pressure on the government to think about forging a healthcare strategy. Now, so governments have to look at their budgets and say, how do we manage healthcare moving forward? The good news here, which I think we need to emphasize, is that because of the growth opportunities, a lot of private money is coming into the market. So with private money, you're going to now have investments at different levels of care. You have almost every graduate who is coming out of school wanting to start their own clinic. You have, I think from my perspective, the agenda that the government has is how can you facilitate the establishment of private sector stepping in big time because governments can no longer pay salaries, build hospitals, provide medicines, provide transport, respond to emergency transportations, prevent epidemics, and survive.
I see. So working together with the private sector.
With the private sector is key.
Okay, we'll have to leave it at that for now. Thank you very much, Dr. Moka Lantam, who's the CEO of iSecure. It's a new innovation in the country. Congratulations once again for beating everybody across the world for doing that. But just goes to show, like you said, a lot of innovation is happening in this part of the world.
Thank you, Yvonne, and it's been my pleasure.
Thank you very much. Even as we focus on what's happening at the World Health Organization meeting in Geneva, as soon as we get the latest from there, we will be bringing that to you. But Dr. Moka Lantam bringing up some interesting issues about where our focus needs to be. This coming story is also a matter of health, and it's because of access to food. Now, hunger in Somalia has doubled the number of children admitted